I was in Toronto playing in the Canadian Football League. On the sideline, I'm out for 6 to 8 weeks with a fractured arm and a partially torn Achilles. I noticed that in our locker room, our athletic trainer has players laying on a table and she has her hands underneath her head. And I look at the guys and they look very relaxed. And so I go up to our trainer, Erin, and I say, "What are you doing?" And she said, "I'm doing something called CranioSacral therapy." So I received this from her for a couple of weeks, and then one day she says, my training professor is also an osteopath, and he does a lot of craniosacral work. You should go see him. So I go to his office, and we talk for about 45 minutes. He was talking about sometimes when you have trauma on top of trauma on top of trauma, it's difficult for your body to resolve all these things. There's a lot of conversation going on about concussions, and there's so much talk about prevention, which is great, but I haven't heard anyone talk about treatment.
It's my hope with this investigative study, this pilot study, that we can give some documentation and some more awareness to players so they understand how important it is for them to really utilize these manual therapy systems that are so valuable. It's not a substitute for rehab. It's not a substitute for the things they've been doing. It is the piece that's missing.
There is science and anatomy and physiology behind the touch that's used in craniosacral therapy. So we're working with tissues of the body and allowing it to relax underneath.
What I want people to really understand is that it has intimate relationships with every system in the body. It is a watertight system. I would describe it as a pulley system almost, in that what happens at the bottom end, the sacrum, affects what goes on in the cranial vault, and vice versa. So you can have a problem with osseous restriction, you can have a problem with membranous issues, you can have a problem with the structure that encases, which is the brain. And as you know, the cerebral spinal fluids, one of its purposes is to protect the brain as best it can. And it can't protect the brain fully when the force is too great. As a skilled therapist is able to discern where those restrictive patterns are, where the motion is compromised, where the compensation has occurred, then we can use our skill to make those changes, help the body assist those changes, would be the appropriate way to say it. We facilitate the change that we see.
The therapist isn't doing something to somebody to get them to change. They're really helping to facilitate that change within that person.
The important thing to know is that it's a continuous system, and because of that, anything that happens anywhere in this continuum has a far-reaching effect.
We see a lot of patients for concussions, whether they're in high school or in college or on a professional level. And when you've had a concussion, you've had a force that's been taken into the cranium or the body, and there's an injury that occurs to the brain. And what it needs is it really needs to rest, and it needs to be able to have fluid get to it and circulate and heal.
Where you look at these football players, and what's really brought concussions to light are players committing suicide, depression, these different issues that players are having. And yes, part of it is concussions, but if we realize like how much banging and hitting and how much stress we put on our bodies, like if you ever watch an old football player walk, you can literally see like where they're locked up. And with this work, it really starts to free you to be less locked up, and it manifests in your body, but for me, it's also manifested in my life.
We are light years now beyond where we started. Those of us who are really involved intimately hold Dr. Upledger's goals and his vision in our hearts. He was the first one to have people really begin to look at the body as a totality.
Craniosacral therapy is a gentle hands-on technique or therapeutic approach that is used to loosen abnormal tensions in membranes within the skull. In Mary Ellen's case, the origin of the whole problem was down in her left knee and ankle. And we had to trace it up through the fascial system, through her pelvis, and up through her spinal column and into her head, and finally over into the right temporal bone.
What I hear from the athletes is either they're afraid and they don't want to look at it, or they've decided that they're going to have dementia when they're 50 years old. And for me, I just want to show them that there is a different possibility. I created the Ricky Williams Foundation back in 1999 when I first got into the NFL. When I took the intensive, it just made so much sense to me to use my foundation to help not only athletes, but to help anyone who could benefit from the work. And connecting with the Upledger Institute has been great, and I look forward to creating a real partnership to help not only athletes, but to help anyone that could benefit from this work. What I'd like to get out of this is really awareness, and to let athletes know that they don't have to suffer.